Hello everyone. Let's focus on the clinical features of the appendicitis. Okay. A what type of symptoms and sign present in case of appendicitis? Okay. In initial form or initial days, the patient present a pain, but what type of pain? Okay, dull aching pain. A patient present with dull aching pain that mainly around the umbilicus. Okay, as the infection is spread, it progresses to the peritoneum and also involve the peritoneum. That's why the patient also experience pain that radiate, not migrate, radiate from the umbilicus to the right iliac fossa, or we can also say that right lower quadrant. Okay. The next patient experience is nausea, vomiting, and anorexia. Okay, anorexia simply means loss of appetite, and nausea and vomiting due to the abdominal inflammations. Okay, and there is fever also. Patient also have fever, and this fever, nausea, vomiting, and anorexia and this pain, all three triadical morphitrite, MURPHY, morphitrite. Okay. Then what are signs present in patient with appendicitis? Then patient feel tenderness at McBurney point. McBurney point simply means 1/3 distance from the anterior superior iliac spine to the umbilicus on the right sides. Okay, means lateral 1/3 distance from the anterior superior iliac spine to the medial 2/3 distance from the umbilicus on the right sides. That's called McBurney point. And patient with appendicitis experience tenderness. But what type of tenderness? Rebound tenderness. We can confuse about rebound tenderness. Rebound tenderness means increased pain or pain sudden release of pressure on the abdomen. Increased pain or pain sudden release of pressure on the abdomen that indicate peritoneal irritations. Okay. Then next sign is Robson sign. What is Robson sign? There is interesting like that. On pressing left iliac fossa, as left iliac fossa, the patient feel pain on the right iliac fossa. Why? But there is a question why. On pressing right and pressing left iliac fossa, the patient feel pain on the right iliac fossa. Why? Do you search it? Okay, search. And next sign is Swas signs. Why Swas signs? In this signs, patient feel pain on passive means मैंने extension किया patient का right hip. I extend the patient right hip. Then in case the patient feel pain means passive extension of the right hip having pain. Then obturator signs. In this pain increase by internal rotation of the right hip. Okay. And Dombey signs. There is other signs. Patient feel pain on coughing. And iron signs. On in this sign, iron signs, a patient having pain if they on toward the epigastric regions on pressing right iliac fossa. Then Terron signs. There is a funny like signs like on pulling right testis gently, the patient having pain in right iliac fossa. Like Terron signs. Okay. Features that include signs and symptoms of the appendicitis.